everyone. My name is Harkiran Sandhu, and today I will be doing a presentation on effective mental health care plan for a person experiencing mental ill health. A bit of introduction about what I will be covering. So these are the various topics I will be unpacking in the subsequent slides. Mental illness, which is anxiety in this case, contributing factors, mental health promotion and illness prevention services, interventions and assessments, and mental health care plan. And finally, I will be doing a reflection on my learning so far. Thank you. I will be discussing about the mental illness of Meera, a 30-year-old culturally and linguistically diverse woman who is a migrant from India. Meera is not her real name, and all personal details have been de-identified. During initial assessment, I assessed Meera as having generalized anxiety disorder that was affecting her relationships and her ability to work. Her main symptoms were restlessness, difficulty concentrating, trouble sleeping, irritability, and fatigue or low energy. There are many contributing factors for her mental illness. Her gender itself is a contributing factor. Females have a consistently higher rates of anxiety disorder. And it has also been noted that culturally and linguistically diverse communities experience higher levels of psychological distress and poorer mental health than other Australians due to having experienced traumatic events such as separation from family and friends or the migration process itself. The lower socioeconomic groups are also strongly associated with elevated psychological distress, and chronic marital distress is significantly linked with increased risk of concurrent anxiety disorders. The Department of Health provides and supports a wide range of programs for mental health in collaboration with the local councils, health providers, and community groups. The Australia Counselling website lists 30 top mental health organizations in Australia, and I've chosen the following from the list that are suited to this patient. The Embrace Multicultural Mental Health Organization may be the most relevant to this person as it promotes mental health and suicide prevention in CALD population. Relationships Australia is another one very relevant for this person as it might support her in resolving her marital discord with her husband. Early intervention in the initial stages of a mental illness can have significant positive changes for a person, not just mentally and physically, but for their socio-economic outcomes as well. It involves the process of providing specialist intervention and support to prevent further illness. Primary care is often the first point of contact with the health system. Primary medical care includes general practitioners and allied and mental health providers, along with other health professionals. People seriously impacted by the illness can be directly referred to specialist mental health services that may involve clinical and or non-clinical services. Several pharmacological and non-pharmacological options are available for anxiety disorders. As part of her assessment, a mental state examination would be done. It is a key assessment tool in understanding a person's mental state at a particular point in time. Another important screening tool in this case is the Generalized Anxiety Disorder Scale, or GAD-7, which is a brief 7-item self-reported measure. Most patients with generalized anxiety disorder have a GAD-7 score of 10 or higher. Meera presented with symptoms of persistent worrying, restlessness, difficulty concentrating, trouble sleeping, irritability, and physical symptoms of sweating and trembling. History Meera arrived in Australia last year. She mostly stays home to take care of her 3-year-old son. Migration to Australia has been really hard on her emotionally and socially as she feels isolated and uprooted from her home. Her cultural background makes her more vulnerable in a new country. Her contributing factors have been her gender, her culturally and linguistically diverse background, financial difficulties, and her carer role to her young son. She has also been having relationship issues with her husband and his family, and all these factors have contributed to her worsening mental health. Impact on person. Meera has been progressively feeling low in energy and self-esteem, unable to sleep properly, which has further led to her being unable to focus or concentrate on her duties as a homemaker. Impact on family. Her illness has impacted her family adversely as she finds it hard to cope with day-to-day tasks and has become increasingly irritable towards members of her family. Risk factors increase the likelihood of a person developing a disorder, and the protective factors decrease the chances of developing a disorder. Meera's identified strengths are good insight, above average intelligence, having low levels of risk-taking behavior such as substance abuse or alcohol abuse. There is no family history of mental illness, and also her ability to be reflective has been one of her strengths. Access to affordable healthcare and support services is another protective factor for her. Her risk factors include her gender, her cold background, adverse life events such as migration, exposure to violence, and lack of social supports. It has been noticed in several studies that migrants have higher levels of anxiety compared to native population of that country. Non-pharmacological interventions such as cognitive behavior therapy or CBT is a type of psychotherapy that has been shown to help people with anxiety issues like generalized anxiety disorder. Pharmacological interventions. Selective serotonin reuptake inhibitors such as escitalopram are usually the first medications that are prescribed to manage anxiety. Other supports such as family and community, especially multicultural community health organizations such as Embrace Multicultural Mental Health Organization has been known to help people with CALD backgrounds a lot. To measure the outcome of the patient's progress, I will be using the Kessler Psychological Distress Scale, also known as K10. It is a 10-item questionnaire answered by the patients themselves that is used to measure their psychological distress based on questions about their anxiety and depressive symptoms that they have experienced in the most recent 4-week period. Scores range from 10 to 50. I think K10 will be the best outcome measure tool for my patient due to its brevity, its ease of use, strong psychometric properties, and good precision they have in their ability to discriminate the DSM-4 cases from non-cases. The mental health care plan for Meera has been created with the involvement of her regular GP and her psychologist. The risk screening tool used was GAD-7 that gave a score of 12 that indicates moderately severe anxiety. The GP prescribed her escitalopram and SSRI, and a referral has been made to the psychologist for cognitive behavior therapy sessions weekly. The goals suggested for first 4 weeks are start the medication, practice mindfulness activities and physical exercise for at least 30 minutes daily, community networking at least once a week, and regular weekly cognitive behavior therapy sessions with the psychologist, and a follow up in 2 weeks. The outcome measurement will be done using K10 scale. I think this mental health care plan will work well for Mira, as it uses both pharmacological and non-pharmacological interventions that are indicated due to the moderately severe anxiety shown by her risk screening tools. The Mental Health Foundations unit has been immensely informative and has given me a deeper understanding of the mental illnesses that are prevalent in Australia. It has been very rewarding doing all the background research to make this presentation. The unit facilitators have been amazing, as always, and thank you very much.